So one of the most common things I hear about that women complain about when they come for their annuals is urinary incontinence, right? It's very common. And it's kind of hard to talk about. It's embarrassing and it's an inconvenience and annoying. And for some women, it's really debilitating, right? And it's very common after childbirth. And then obviously the older you get, the more frequently it happens, right? So there's lots of different options to treat incontinence. And if you haven't talked to your doctor about it, you should. So that brings me to my favorite treatment option, which is vaginal PRP. Or the orgasm shot. Both of them use your own blood, and we draw your blood, spin it, and we take out the platelet-rich plasma, and we can inject that down there in certain places. And over time, it will rejuvenate the vaginal tissue, it increases the blood flow, and it helps to improve the incontinence. And the results I get with patients are phenomenal. I would say I get 80 to 90% resolution for the majority of my patients. I always tell people it's a 2-minute procedure and we're usually laughing and talking the whole time, but you're gonna be in the office for an hour. For me, I did it a couple of years ago and I've been doing it probably every year and a half since because I leaked after I had my last daughter, right? And it is embarrassing to walk down the hall and have to stop and cross your legs and brace yourself, right? We've probably been there. If you do it, you know what I'm talking about. And it was the best option for me because it was non-surgical and it didn't interfere with taking me out of the office and having to go and do physical therapy, which I didn't have time for with a 1-year-old and a 3-year-old at home. And for me, when I did it, I had a 2-minute injection, and then 3 weeks later, I was like, oh, I don't know, I don't feel anything yet. But at the month mark, I realized I didn't leak that week, and that's incredible. And I actually paid attention from that point on, and I went a year and a half without an accident. A year and 2 months without an accident. And then it started to slowly creep back, but I was like, hey, I'm doing it again. That was so easy. Why wouldn't I, right? And that's what I've been doing since then, and it works for me.